If you're over 60 and you believe walking is enough to stay healthy, we need to talk. Walking is good. I recommend it to my patients every day. But after 60, your body changes. You lose muscle mass. Your balance declines. Your bone density drops. Your metabolism slows. And walking alone does not stop that process. I'm Dr. Leonid Kim, MD, and today I'm going to show you 5 exercises that are more powerful than walking for protecting your heart, brain, joints, and independence after 60. These are surgeon-approved, science-backed, and safe when done correctly. After the age of 60, something silent begins to happen inside the human body, something you cannot see in the mirror, but that determines whether you will live independently or depend on someone else to stand up from a chair. Every single year after 60, adults can lose up to 1% of their muscle mass, and in some individuals the decline accelerates to as much as 3 to 8% per decade, a process medically known as sarcopenia. And it is one of the strongest predictors of frailty, falls, hospitalization, and loss of independence. The tragedy is that most people do not notice it until the day they try to stand up and feel their legs hesitate beneath them. As a surgeon, I have seen patients walk into my clinic confident and mobile and return months later after a fall that changed their life forever, and often the warning sign was there long before the fall happened. Difficulty rising from a chair. The simple act of standing up is not simple at all. It is a full symphony of muscle fibers firing in coordination, glutes activating to extend the hips, quadriceps stabilizing the knees, core muscles preventing collapse, and neural pathways transmitting signals from brain to muscle in milliseconds. When those systems weaken, the body whispers before it screams. Research published in Geriatric Medicine has shown that the ability to perform repeated chair stands is directly associated with lower mortality risk, meaning your capacity to rise from a seated position is statistically linked to how long you live. That is not fitness culture hype. That is survival biology. When you sit down, gravity wins, but when you stand up under control without using your hands, you are telling your nervous system, your bones, and your metabolism that you are still strong, still adaptive, still resilient. Studies demonstrate that lower body strength is one of the most powerful protective factors against falls, and falls are the leading cause of injury-related death among adults over 65. One fall can lead to a hip fracture, and nearly 1 in 3 older adults who suffer a hip fracture will not regain their previous level of independence. Think about that for a moment. One unstable rise from a chair can begin a cascade that changes the trajectory of your life. The sit-to-stand movement directly trains the muscles responsible for preventing that cascade. It targets the gluteus maximus, the largest muscle in the body, which naturally weakens with age due to inactivity and hormonal changes. It strengthens the quadriceps, which are essential for stabilizing the knee joint and absorbing force when you move. It activates the deep core stabilizers that protect your spine and maintain posture. And perhaps most importantly, it challenges the neuromuscular system, reinforcing the brain-to-muscle communication that declines as we age. Brain imaging studies show that resistance-based functional movements increase neural activation patterns in older adults, essentially keeping the motor cortex engaged and responsive. This is not just about legs. This is about preserving the command center of movement itself. There is also a metabolic truth that many people overlook. Skeletal muscle is a major site for glucose disposal, meaning the more active and strong your muscles are, the better your body regulates blood sugar. Insulin sensitivity declines with age, increasing the risk of type 2 diabetes, but strength-based movements like repeated chair stands have been shown to improve insulin sensitivity and glucose uptake in muscle tissue. That means this one simple movement influences not only mobility, but also metabolic health and cardiovascular risk. When you stand up from a chair repeatedly with control, you are stimulating muscle protein synthesis, especially when combined with adequate dietary protein, counteracting the age-related muscle breakdown that accelerates after 60. Clinical trials in older adults reveal that even low-load functional resistance exercises performed consistently can significantly increase lower body strength within weeks. The beauty of the sit-to-stand is that it mirrors real life. You do not need a gym. You do not need expensive machines. You need a chair and the decision to act. Cross your arms over your chest so you cannot cheat with momentum. Place your feet shoulder-width apart so your knees track safely over your toes. Lean forward slightly from the hips to shift your center of gravity, then press through your heels and stand with intention, squeezing your glutes at the top. Then lower yourself slowly, controlling the descent, because eccentric muscle control, the lowering phase, is where much of the strength adaptation occurs. Perform 10 repetitions, rest, and repeat. What feels ordinary is in fact profoundly protective. Longitudinal studies show that older adults who maintain lower body strength have lower rates of institutionalization and higher quality of life scores. Independence is not random, it is trained. Every repetition is a vote for future mobility. Every controlled rise is a message to your bones that they must remain dense and responsive to load. Mechanical stress from muscle contraction stimulates osteoblast activity, the cells responsible for bone formation, which is critical in preventing osteoporosis. Walking alone does not provide sufficient resistance to meaningfully increase bone density in most individuals over 60, but repeatedly lifting your body weight from a seated position creates enough mechanical demand to signal adaptation. This is how biology works. Stress the system appropriately, and the system adapts. Neglect it, and it declines. There is also a psychological dimension that cannot be ignored. Confidence in mobility reduces fear of falling, and fear itself changes gait patterns, increases stiffness, and paradoxically raises fall risk. When you practice standing up with strength and control, you build not just muscle fibers but confidence circuits in the brain. You remind yourself that you are capable. I have watched patients transform not only physically but emotionally when they regain the ability to stand without assistance. The dignity in that moment is profound, and here is the truth that should keep you watching until the end. The difference between dependence and independence in later life is often determined by small daily actions performed consistently. The sit-to-stand exercise may appear almost too simple to matter, but simplicity is not weakness, it is precision. It is targeted functional training aligned with the exact movement pattern required for daily survival. If you are over 60, do not underestimate this movement. Perform it daily. Track your repetitions. Aim to improve gradually. If 10 feels easy, increase to 15. If you struggle, begin with assistance and reduce it over time. The body responds to challenge at any age. Research confirms that even individuals in their 70s and 80s can gain significant strength through progressive resistance training. Aging does not eliminate adaptability. Inactivity does. 1 chair, 10 repetitions. 2 sets, less than 5 minutes. Yet within those minutes lies protection against falls, fractures, metabolic disease, and loss of independence. The question is not whether it works. Science has already answered that. The question is whether you will act before your body forces you to. Stand up today, not just from a chair, but from complacency, because every strong rise is a declaration that aging will not quietly take what you are willing to train to keep. After the age of 60, the most dangerous weakness is not always in your legs. It is often in your upper body, hidden in the slow collapse of your shoulders, the quiet thinning of your bones, and the gradual loss of pushing strength that you do not notice until the day you cannot brace yourself during a fall. Muscle mass does not only disappear from the thighs, it fades from the chest, the arms, and the shoulders, and this decline directly affects your posture, your breathing, and even your heart efficiency. Research shows that adults over 60 can lose significant upper body strength each decade, especially if they do not engage in resistance-based movements, and this loss is strongly associated with increased disability and reduced quality of life. When the chest muscles weaken and the upper back fails to counterbalance them, the shoulders round forward, the spine curves, and a condition known as age-related kyphosis begins to take shape, compressing the lungs and reducing respiratory capacity. Studies in geriatric populations have demonstrated that excessive thoracic curvature is linked to decreased pulmonary function, meaning less oxygen enters the bloodstream with every breath. Less oxygen means the heart must work harder to supply tissues, increasing cardiovascular strain over time. This is not cosmetic posture advice. This is cardiopulmonary survival. The simple wall push-up, often underestimated because it looks easy, directly challenges the muscles responsible for maintaining upright posture and controlled pushing strength. When you stand an arm's length from a wall, place your palms flat against it and slowly lower your chest forward. You are activating the pectoralis major, the anterior deltoids, and the triceps brachii, muscles that play a critical role in stabilizing the shoulder joint and supporting daily functional tasks like getting up from the floor or pushing open a heavy door. Research confirms that resistance exercises, even low-load variations like wall push-ups, stimulate muscle protein synthesis in older adults, helping counteract sarcopenia not only in the lower body, but throughout the entire musculoskeletal system. And muscle does more than move bones. It protects them. Bone tissue responds to mechanical stress through a process called mechanotransduction, where osteocytes sense load and signal for bone remodeling. After menopause in women and with age-related hormonal decline in men, bone mineral density drops, increasing the risk of osteoporosis and fractures. Studies consistently show that resistance training is one of the most effective non-pharmacological strategies to slow bone loss. Walking, while beneficial for circulation, does not sufficiently load the upper skeleton to stimulate meaningful bone adaptation in the arms, shoulders, and wrists. Yet these are precisely the areas people instinctively use to brace themselves during a fall. Wrist fractures are among the most common injuries in older adults attempting to break a fall, and reduced upper body strength dramatically increases fracture risk. By performing controlled wall push-ups regularly, you are training your body to generate force safely and absorb impact more effectively. There is another layer of science that many people overlook. Upper body strength has been correlated with reduced all-cause mortality in several population studies, independent of cardiovascular fitness. Grip strength alone has been used as a biomarker for overall health status, predicting future disability and even survival rates. Wall push-ups indirectly contribute to improved grip and forearm stability because they require isometric engagement of the hands and wrists against resistance. Each repetition is not just about the chest, it is about the entire kinetic chain from fingers to shoulders. Furthermore, resistance-based pushing movements enhance neuromuscular coordination, reinforcing motor unit recruitment patterns that naturally decline with age. As we grow older, the nervous system becomes less efficient at activating muscle fibers simultaneously, reducing force output and reaction speed. Regular resistance exercise has been shown to improve motor neuron firing rates and synchronization, effectively keeping the communication between brain and muscle sharp. That connection can mean the difference between catching yourself and collapsing during a stumble. The cardiovascular benefits are equally compelling. Controlled resistance movements elevate heart rate moderately and improve vascular function without the joint stress associated with high-impact exercise. Studies indicate that strength training improves endothelial function, the health of the inner lining of blood vessels, supporting better blood flow and reducing hypertension risk. When combined with proper breathing, inhaling as you lower and exhaling as you push away from the wall, you enhance thoracic expansion and diaphragmatic control, further supporting oxygen exchange efficiency. Better oxygen delivery translates to improved stamina and reduced fatigue in daily life. The beauty of the wall push-up is its scalability. For someone just beginning, standing farther from the wall reduces intensity. As strength improves, stepping closer increases load. Eventually, progression to countertop push-ups or modified floor push-ups becomes possible, creating a pathway of continual adaptation. Research confirms that progressive overload, gradually increasing resistance over time, is essential for sustained muscle growth and bone preservation. Even individuals in their 70s and 80s have demonstrated significant strength gains within 12 weeks of consistent resistance training. Aging does not eliminate the body's ability to adapt, it only demands a more deliberate stimulus. There is also a psychological transformation that accompanies regained upper body strength. When posture improves and the chest opens, confidence rises. Studies in behavioral science suggest that upright posture positively influences mood and perceived energy levels. Oxygen intake improves, fatigue decreases, and daily tasks feel less overwhelming. The act of pushing your body away from a wall may seem small, but symbolically it reinforces autonomy. It tells your nervous system that you are still capable of generating force, still capable of resisting gravity, still capable of defending your stability. In clinical practice, I have seen patients who avoided upper body training because they believed it was unnecessary or too difficult, only to struggle months later with simple actions like rising from the floor after kneeling. The ability to push through your arms can determine whether you can recover from a minor slip without assistance. Independence is often measured in moments like these. Perform 10 to 15 controlled repetitions, focusing on slow descent and steady return. Feel the chest engage. Feel the shoulders stabilize. Feel the triceps extend the elbows with purpose. Complete 2 sets, 3 to 4 times per week, and you are actively investing in bone density, muscle mass, neural coordination, cardiovascular efficiency, and fall protection. That is a powerful return on a small-time investment. The most dangerous myth after 60 is that gentle walking alone is sufficient to maintain strength. Walking supports circulation, but it does not challenge the upper body in a way that preserves pushing power or bone resilience. The wall push-up fills that gap with precision and safety. It is joint-friendly, adaptable, and profoundly protective. Each repetition is a message to your skeleton that it must remain strong. Each push is a signal to your heart that it must stay efficient. Each controlled movement is a rehearsal for the day you might need to catch yourself and prevent catastrophe. The difference between fragility and resilience can be built against a simple wall in your own home. Do not wait for weakness to announce itself through pain or injury. Train before decline accelerates. Strengthen before fear sets in. Because the ability to push your body away from a wall today may one day allow you to push yourself up from the ground, and that single moment could preserve your independence, your dignity, and your life. Every 20 seconds, somewhere in the world, an older adult falls, and every fall begins with a moment so small it is almost invisible. A misstep, a shift in weight, a delay in reaction. And after the age of 60, that single moment can change the rest of a life. Falls are the leading cause of injury-related deaths among adults over 65, and millions more suffer fractures, head trauma, and a permanent loss of confidence that silently reshapes how they move through the world. What most people do not realize is that the true cause of many falls is not weakness alone, but imbalance, a gradual breakdown in the body's ability to coordinate vision, inner ear signals, joint position awareness, and muscle response in perfect harmony. Balance is not a talent you are born with and keep forever. It is a system, and like every biological system, it deteriorates when it is not challenged. By the time many adults notice instability, the decline has been happening for years, hidden behind routine movements that never truly test the limits of equilibrium. This is where the heel-to-toe walk becomes more than an exercise. It becomes a neurological intervention. When you place one foot directly in front of the other, heel touching toe in a straight line, you narrow your base of support dramatically, forcing your body to activate stabilizing muscles and recalibrate spatial awareness. Research in geriatric rehabilitation shows that tandem walking, the clinical term for heel-to-toe walking, is a validated measure of balance impairment and a powerful tool for improving it. In laboratory settings, reduced performance on tandem gait tests strongly predicts future fall risk. That means difficulty performing this simple movement is not random, it is a warning sign. The human balance system relies on 3 primary inputs: the visual system, which tells you where you are in space; the vestibular system in the inner ear, which detects head movement and orientation; and the proprioceptive system, which provides feedback from muscles and joints about body position. With aging, each of these systems declines. Vision loses acuity and contrast sensitivity. Vestibular hair cells in the inner ear decrease in number. Proprioceptive receptors in the ankles and knees become less responsive. The brain must work harder to integrate weaker signals, and reaction time slows. Studies indicate that reaction speed can decline significantly with age, increasing the likelihood that a stumble turns into a fall. Heel-to-toe walking deliberately challenges all three systems at once. When you move slowly along a straight line, eyes focused forward, arms slightly extended for control, you are forcing your brain to process spatial information with precision. The narrow stance increases reliance on ankle stabilizers, particularly the peroneal muscles and tibialis anterior, which play critical roles in correcting lateral sway. Weakness in these muscles has been directly associated with higher fall rates in older adults. By practicing tandem gait, you stimulate neuromuscular adaptation, enhancing the speed and coordination of corrective muscle responses. Clinical trials have demonstrated that structured balance training can reduce fall risk by as much as 30 to 40% in community-dwelling older adults. That is not a minor improvement. That is a dramatic shift in probability. Beyond the physical consequences, the psychological impact of falls is profound. After one fall, many individuals develop a fear of falling, which leads to reduced activity, muscle deconditioning, and social isolation. Ironically, this fear-driven inactivity increases fall risk further, creating a vicious cycle. Balance training interrupts that cycle by restoring confidence through measurable improvement. When you successfully complete even 2 minutes of heel-to-toe walking without losing stability, you are not just training muscles. You are rebuilding trust in your body. Brain imaging research reveals that balance exercises increase activity in areas responsible for motor planning and coordination, suggesting that the central nervous system remains adaptable even in later decades of life. Neuroplasticity does not disappear at 60. It simply requires stimulation. Each deliberate step in a heel-to-toe walk strengthens neural pathways that govern stability. This movement also enhances core engagement. As you narrow your base of support, deep abdominal and spinal stabilizers activate reflexively to maintain alignment. These muscles, including the transverse abdominis and multifidus, are essential for spinal stability and posture. Improved core control reduces excessive sway and enhances gait efficiency. Furthermore, tandem walking slows movement intentionally, encouraging mindfulness and proprioceptive awareness, qualities often lost in hurried daily activity. Slower, controlled movement has been shown to improve motor learning, reinforcing correct patterns more effectively than rushed repetition. There is another dimension that rarely receives attention: cognitive function. Balance tasks that require concentration have been linked to improvements in executive function and dual task performance, the ability to think and move simultaneously. Studies show that older adults who struggle with dual task walking, such as walking while talking, have a significantly higher risk of falls. Heel-to-toe walking demands focus. It forces the brain to allocate attention to coordination, effectively training cognitive motor integration. This crossover effect means balance training may indirectly support cognitive resilience. The execution is simple but powerful. Stand near a wall or sturdy surface for support if needed. Place your heel directly in front of the toes of your opposite foot. Move slowly. Feel each shift of weight. Allow your arms to extend slightly for counterbalance. Take 10 controlled steps forward, then pause. Repeat for 2 minutes. If stability improves, reduce reliance on support. The goal is not speed, it is precision. Research emphasizes that quality of movement matters more than quantity in balance training. Small, consistent practice sessions produce significant neurological adaptation over time. The cumulative effect of daily 2-minute sessions can translate into measurable improvements in postural control within weeks. Consider the alternative. Without targeted balance training, instability progresses quietly. A misstep on uneven pavement, a slippery bathroom tile, a dimly lit staircase, and suddenly independence is compromised. Hip fractures carry a 1-year mortality rate that can approach 20% in some populations. Many survivors never regain their previous mobility. These are not distant statistics. They are outcomes witnessed daily in hospitals around the world. And yet, the intervention can begin at home, in a hallway, with a straight line and focused intention. Every heel-to-toe step is a rehearsal for real life. It prepares you for narrow pathways, crowded spaces, unexpected shifts in terrain. It strengthens the reflex that allows you to recover from imbalance instead of surrendering to it. Balance is not merely about standing upright, it is about maintaining control when unpredictability strikes. Aging does not eliminate your capacity to improve this system. On the contrary, research consistently shows that even adults in their 70s and 80s experience meaningful gains in balance performance through structured training. The nervous system responds to challenge, regardless of age, provided the challenge is specific and repeated. Heel-to-toe walking is specific. It targets the precise mechanisms that deteriorate with time. It is safe, adaptable, and profoundly effective. The choice is simple but urgent. You can wait until instability reveals itself in the form of a fall, or you can train your balance deliberately, reinforcing the systems that keep you upright. 2 minutes a day may not seem life-changing, but statistically, it can be. The difference between a stumble and a fracture often lies in milliseconds of corrective response. Those milliseconds are trainable. With each focused step, you are strengthening your brain's ability to react, your muscles' ability to stabilize, and your confidence to move freely. Independence is preserved not by luck, but by preparation. And preparation begins with one careful step placed directly in front of the other. Heel touching toe, eyes forward, body steady, refusing to let gravity decide your future.